Good afternoon. We'll be getting started here in just another minute or so. Just wanted to let you know and thank you for being here, but we'll get started in just a few more minutes. Good afternoon, everyone, or good morning if you're behind us. Thanks again for coming. We are going to get started here in just another minute or so, but I just wanted to welcome you all to Community Health Worker Professional Development Series offered by the South Texas Community Health Worker Workforce Preparedness Collaborative. Yeah, what I was going to say, I've got some help from Brittany on this call. We were just going to ask if you guys are willing to just do in the chat who you are, where you're calling in from, and if you're a Texas certified CHW, if you could just add your CHW number, just helps us with our tracking pieces. But yeah, quick introduction to yourself in the chat, name, where you're coming in from, maybe your affiliation if you're working for an agency, and then your CHW number if you're registered, certified here in the state. I'm going to give us another minute or so just to allow people to pile in, and then we're going to get started because I got a lot of ground to cover. But thanks again for being here. Yes, Juanita, I see your hand is raised. You have a question?
No, I don't have a question. I'm just having trouble to get my computer going.
Okay.
Thank you.
Love it. Thank you, everyone, for telling us who you are and where you're coming from. Looks like we got a good group here from around the state, maybe even around the country. I'm trying to keep my eye on the chat, but it's always challenging when you're hosting. And so because we've got a lot of ground to cover, and this session was originally designed to take an hour and a half. We're not here for an hour and a half. We've got 1 hour, so I want to make sure that we use our time wisely.
You're
So
not coming to the webinar, Rosa.
I'm going to go ahead and get us started. And I'm going to ask just to begin with, if everyone wouldn't mind just muting themselves, just so we don't get any feedback. I'm also going to ask Brittany, because I think she can go ahead and mute everyone just to get us started. I do want to invite communication and collaboration and feedback as we get going, and I'll kind of open it up for a few opportunities for us to share with each other. But by way of introduction, my name is Jason Rosenfeld. I'm an associate professor here at UT Health San Antonio in the Department of Medicine. I'm a public health professional, direct global health education, and I'm also a community health worker instructor and ally. Been working with community health workers around the world for pretty much my entire career, which started off as a United States Peace Corps volunteer in West Africa, and have had the opportunity to work with and collaborate with CHWs in Southern Africa and the Caribbean, and also here in the United States. So I'm excited to have this opportunity to be with you all today to share this session on project management and leadership for community health workers. This module was developed as part of our South Texas Community Health Worker Workforce Preparedness Collaborative, which is a program funded by HRSA for the CHW such your speaking language. All right, hold on a second. Sorry. There we go. The collaborative is a HRSA-funded CHW training program. There's over 80 of these funded across the United States. And our program for South Texas is focused on 38 counties from San Antonio out to the border in Del Rio, Laredo, down to Brownsville. And this professional development series is part of our ongoing effort to address the workforce needs of you, our CHWs, in the field. And this module was created as feedback that was provided by our CHW network, saying there was interest in learning more skills, tips, and tricks for how to be an effective manager and leader of teams. So with that said, and Belle, hey, it's good to see you. I know there's other members of our Workforce Collaborative here. So without further ado, I'm going to go ahead and jump into this. So yeah, keep on. No, you're good, Brittany. Don't worry about it. I'm going to go ahead and get us started. Keep on putting your name and affiliations in the chat, and Brittany's going to help me keep track of the chat. If you've got any questions at any point in time, feel free to unmute or use the chat to let me know. And like I said, I'm hoping to hear from you throughout this session. So the objectives for today are to talk about the difference between leadership and management. We want to talk about the project management process and cycle. Hopefully by the time you leave this session around 1 o'clock, you will be feeling confident in your ability to write what we call as a SMART objective. And then finally, I'm hoping that you'll be able to walk away from this session being able to utilize 3 project management tools. And I'm going to present you a whole bunch of project management tools, but I'm hoping you'll at least walk away with 3 of them. So with that said, let's jump into this real quick, and whether you can unmute or share it in the chat. Who do you consider to be a leader and why? This is just going to get us going. Just want to hear a little bit about who do we consider leaders in our community in general, and why do you consider them a leader? Anybody want to share?
Something I think of would be like our teachers in schools. I'm a school-based community health worker, so that's my, specialty, I guess, in the community health worker side. But like, our teachers, we have a ton of, the students who look up to them and who, maybe this is the only time of the day that they have, a good day, or, they might not have the best home life, or maybe they don't get, fed at home. So I just feel like, teachers, principals, really all of the staff in the school are leaders to, our younger population who we are helping raise. So it takes a village.
Yeah, thank you, Bailey. And I love the fact that you're based at a school, and I'd love to learn more about how you guys have set that up, because it's an effort that we've been trying to continue to promote through our program. But yeah, you're right. I mean, our campus has leaders all over the place, and they're shaping the next generation of leaders every single day. So I appreciate you sharing that. Ludvina, would you like to share, Ludi?
Yes, so I would like to share that a lot of times we don't think about our parishes or our churches where we have volunteers and people that are very connected and have a close relationships with the parishioners and the community, and their leaders in their community, bringing in a lot of information and resources to their communities, but they're unsung heroes in our community.
Yeah, our faith leaders, those community-based leaders, I mean, so many don't necessarily get recognized with that big L leadership, right? But they are such important leaders in our community. And Tia, I see your hand. I just wanted to quickly talk about people are throwing in the chat. People who have
I was going to
knowledge
say
of
there's a lot of great things in the chat. So
yeah, people who have knowledge about a subject, CHWs are leaders. Seasoned adults, I like that term. I'm going to start calling myself a seasoned adult, maybe. Tia, did you want to share a little bit as well?
Good afternoon, Jason. Thank you so much for giving this training. It's nice to see you. I did want to say that the way I see leaders are, they start at home. So I see the moms and the dads of this community leaders. I see the grassroots nonprofits, the ones that are on the front line, the ones that can get to the children and the adults before they actually get to a place of either teaching or going or community centers. they have us. So I see us as leaders as well.
Yeah, I love it. I mean, again, it's like you said, it's the same idea as like our teachers, right? We're constantly building and shaping our next generations, and all of that requires leadership. And I wanted to call out something that that Sonia in the chat wrote, which is a leader is a person who inspires, supports, motivates to their members, right? And I think that's a really important part of this. It's about the kind of characteristics, the things that that leaders kind of carry with them. And so I wanted to ask this question, which is there a difference then between leaders and managers? And if so, what do you think some of those differences between somebody who leads and somebody manages are?
I'm gonna say yes.
Mhm.
A manager may have some say in the day-to-day operations of projects and boots on the ground. Leadership may be making decisions based on outcomes and deciding which direction they want the team to go in.
Okay. So managers kind of day to day moving the thing along, leaders kind of thinking about the bigger picture and the end goal of where we're going, if I captured that correctly.
And we're getting a lot of yeses. There is a difference. And then I wanted to point out that Claudia in the chat, she put, but a manager can be a leader.
Yeah, thank you, Claudia. There doesn't have to be a difference between leaders and managers, right? But oftentimes the skills can be different, right? And so one of the things that you'll see in this image that I've put up is this kind of encapsulation of what leadership and management can be, right? You got this guy saying our process is extremely efficient. Yes, but we're not going anywhere. So this guy on the left would be kind of your manager. We're doing it really well, but the leader's saying, but where are we going? What are we doing? And I know that there's other things coming into the chat, and again, just call a few of those things out. Management is for task, leading is for people to be accountable. Leaders show the way. Vision is the quality of a leader. Yeah, motivational versus kind of task orientation. Man, you guys are great. I don't have to do a whole lot of teaching today. And Brittany, if I jump in front of you, I apologize.
No, you're good. You're good.
But yeah, there's this quote from the Harvard Business Review back in the day that says managers are people who do things right and leaders are people who do the right thing, right? I think there's all sorts of ways that we can phrase this, but I do want to land on the point that you all have made is that they don't necessarily have to be different, but the skills that usually are utilized by leaders may look different than those of managers, right? And so this idea of leadership, you guys have already talked about it and kind of given us some definitions, but ultimately, in my mind, without influence, leadership doesn't necessarily exist. So this idea of leadership focuses on the group process. There's kind of these ideas of personality and how do you bring your authenticity to the work that you're doing. There's power relationships. It can be a transformational process where oftentimes, as we've kind of talked about already, management is about let's make sure that the trains are leaving on time, that they're filled with the things that they're supposed to be filled with, and that they're meeting the needs of where we're trying to go. So again, this idea of leadership is this process by where we influence a group of individuals to achieve a common goal. So think about it as simple as this. Leadership is setting the vision and the direction. Managers are making sure we get to where we're going. So then there's this question of why do we need project management? And so for any folks that have been trained in project management, then you'll probably already know the answers to this. But ultimately, when we're thinking about projects, whether they're the smallest of projects, fixing a fence at home, maybe that's not a small project, it's just on the forefront of my mind because I need to fix my fence, to implementing a complex public health project, we need to have project management to make sure that the vision that you've set, the goals and objectives that you have set are going to be achieved on time, on budget, and to the point that you're hoping for how you would get there. Right. So that's ultimately what the goal of project management is to make sure that all the cats are running in the same direction and that we're working towards the ultimate goal that we have set out for ourselves. And so project management is defined here on this slide is the initiating, planning, executing, controlling, and closing of the work of a team. And oftentimes it is team oriented, particularly when we're thinking about it in the public health context, right? For those of you that were able to join our last professional development series, we talked about the role of the CHW within the work of public health. And so when we think about public health, it is a team-based endeavor, right? So when we're doing projects, by definition, we need to learn and better manage the entire teams to achieve our goals, to meet success criteria in a specified time. And so this is the ultimate kind of cycle from initiate to plan to execute to validate and evaluate. So my question for you before we move on is, as community health workers, where do you traditionally fall within this cycle? Is it any one of these particular sticky notes? Is it multiple sticky notes? But maybe again, if you want to share in the chat or unmute, kind of what are your typical responsibilities as a CHW within the project management cycle?
I feel as if, you know, honestly, it kind of just depends on the situation at hand, you know, like what's going on with the person that we're being referred. There are sometimes that, you know, I am just there to validate, you know, maybe they are okay at doing that, but maybe they just need that extra, you know, push and, you know, support. But then, you know, there are some times that, you know, they don't know where to start. So we come up with a plan together, you know, and then work on, you know, the executing of it, and then continue, you know, to validate them throughout the process of them learning to do it on their own. So I just, you know, feel like it depends on what exactly you're handling that moment.
Yeah, it's context specific. I appreciate that, Bailey, right? And then Brittany, I'm going to let you give us a quick summary in the chat.
Yeah, so I'm seeing a lot of execute, health initiatives and policy, most of the time execute, plan, validate. It just sounds like, you know, our CHW is there in every aspect of it.
And Lisa Kidd, I see you've unmuted. I didn't know if you wanted to jump in or not.
I did. I wanted to say, for me, it feels like we kind of get in where we fit in. So like all the shoes fit, you know, if we need to provide a plan, if we need to validate the necessity or the needs, the parts that we need, if we need to work on the initiative behind it, all of those things, it's like all hands fit for community health workers in my experience.
Yeah, no, thank you for sharing that, Lisa. And I think, you know, from what I've also heard and seen and gotten feedback from our community of CHWs is oftentimes CHWs are kind of thrown into the execution phase, right? You are boots on the ground. You guys have heard this over and over again, frontline public health workers, and that's really important. However, if you're not involved in the initiation and planning phase, then it could be that the execution is misaligned, right? And if you're not involved in the validation and the evaluation phase, then maybe we're measuring the wrong things around what you've actually been doing in the community. And so the reason I bring this up is to say, I'm glad to hear those of you that are saying you're involved in all of these phases, but oftentimes in my experience, CHWs are said, here's what you do, go do the thing, and then tell us how it went. And my argument is that we as CHWs and as allies should be thinking about engaging you as a workforce in this entire cycle, because it's only going to improve the overall implementation of the project itself. And oftentimes as CHWs, as your workforce is growing, you're asked to do this project management without necessarily having the requisite skills and training to do it, right? I'm not saying that as it's a broad generalization. And so again, this idea of this session was meant to help begin to fill in some of those gaps. So thank you guys for sharing. So what we're going to do next is we're going to dive into each of these phases in a little bit more detail. I'll spend some more time on some than others, just because there's more content that we can share. But during the initiate phase, there's kind of four main things we want to think about, which is we got to first start with assessing the situation, right? So what is the current context and what are the needs and or strengths in our community that we can build upon and really that we want to work to address? And then once you have identified those needs and those priorities, then you can begin to develop your plans. And I always say put your alternatives, because plan A is most likely not going to happen. Plan B maybe will happen, but you got to be ready for plan D and E because things are going to change. Funding will change, the environment will change. And if we go in with only one plan, then we're already setting ourselves up for some challenges. And then finally, we have to think about how are we integrating this program, this project with our overall strategy and vision? Because if it doesn't align, then we're starting to use resources and time in a way that may not be most effective for our agency or for our own work that we're doing. And so for this phase, really what I'd like to talk about mostly is the assess and determining the needs piece. And what I want to draw your attention to is that there's multiple ways to determine the need, right? You can go out and you can collect your own data, and you as CHWs, we as that workforce do it all the time. You're talking to people, you're listening, you're gathering information from people and determining what that is. But you can also go to existing data sources to understand what is the broader need that exists. And I wanted to share just a couple of examples here. So here in San Antonio, we live in Bexar County. Every 3 years, we do the community health needs assessment, right? I think every hospital district around the country is required to do this. This is publicly available data that has pretty good nuanced data about health literacy, about socioeconomic factors in our community, health insurance coverage, etc. So you can use that data to then paint a picture that can ultimately go into a proposal or make an argument for the program that you want to implement. I've also showed you here some data from the CDC. So the Centers for Disease Control have tons of data dashboards, and this is just showing you diabetes and obesity prevalence by county, right? So you've got low obesity, low diabetes in the left-hand corner, high diabetes, high obesity at the same time in the upper right-hand corner. So the deep dark purple is where you've got those two comorbidities existing. And again, you can use this data to make your argument for what you want to make. And so again, you can complement this secondary data, which means somebody else collected it, with your own data that you'll collect from stories, from surveys, or otherwise to basically determine your need, to demonstrate the need for the project that you want to initiate. So that is all I was going to talk about on Initiate, because again, like we could do a whole semester-long course on this one topic that I'm squeezing into the next 40 minutes. And yes, I appreciate what everyone is sharing in terms of rapid assessments and health needs assessments. And what I want to spend most of our time on today is in the planning and execution phases, because there's a lot of tools that I want to share with you. And so within the planning phase, we've got partner coordination and communication. So we have to start with, am I going to do this all by myself? And if I'm not, then who am I doing this with? And let's make sure that I've talked to them early and often, and we have clear expectations for what we're going to be doing. We've got to set our goals, right? So you need to make sure that you've got your big, hairy goal that you're aiming for that's then supported by your very specific objectives. And this is where we're going to talk about SMART: specific, measurable, attainable, realistic, and time-bound objectives. From there, you need to build out your activities or tasks. And I'm going to teach you about 3 different tools that can help you do this. The first is a logic model, then a logical framework, and then a Gantt chart. And then finally, we're going to talk a little bit about budgeting, give you a basic template for how you budget for your program to align with your objectives and your activities, and then think about team building. And then finally, I put on here checklists, because for any project manager, pretty much any professional, I would recommend, if you don't use checklists, start using checklists. The best way to keep yourself organized, and this is something that I've had to learn as a former freewheeling individual who liked to just fly by the seat of my pants, that as things became more complicated and I took on more projects, everything goes into a notebook with checklists, because if I don't have it, then I have no idea what I'm doing. So let's dive into these topics a little bit more specifically. So the difference between a goal and objective are laid out here on this slide. So you start with goals on your, I guess this is everybody's left, I think, if I got this correctly. It's a broad and brief statement of intent. What are we trying to do? It gives you your focus for your planning. And oftentimes your goal is not very specific and it may not be measurable, right? So here's a goal: to improve health equity in South Texas. not sure what that means. We have ideas of what health equity means, but it may be really hard to measure that over time. So what we need is some very specific objectives to tell us as to whether or not we are meeting that goal. And that's where these SMART objectives come in. They're realistic, they are written in an active tense, they use strong verbs, and they answer this following question. Who is going to do what? When are they going to do it? Why are they going to do it? And to what standard are they going to do it? And I'm going to back up to the goal before we run back into the objectives again. So this is the basic alignment. You got your goal, your objectives feed into your goal, and then everything flows from there. When thinking about goals, it's important to think about your own organization, because ideally they have set out their own goals for what they're trying to achieve, but you can also lean into national level goals, regional level goals that can give your objectives and your activities specificity and focus. So here I'm showing you the Healthy People 2030 website. This is just a screenshot, and it's really focused on the nutrition and healthy eating objectives. And so these are goals that you can put in at the above of your program. So really my goal is to reduce household food insecurity and hunger. And what you do is you now know you're aligned with national level programs that are working towards the same effort. Now your activities and your objectives may look different, but at least it gives you alignment with what other people are trying to achieve around the country. And then this brings you into your SMART objectives. So we're going to spend just a few minutes here to talk about what does this mean. So a SMART objective is specific. It means what are we doing and who are we doing it for? We need to be able to measure it. If you can't measure it, then you don't know whether or not you're doing it or you're doing it well. It has to be achievable. So can it get done in the timeline that we've set for ourselves and with the resources that are available? So again, you're not going to say, I'm going to reach 25,000 people in a 1-week period. That's just not attainable, right? So you have to think about what is realistic and attainable. Is it result oriented? This is where your goal and objective alignment must be considered. And then finally, when will the objective be achieved? So when you think about writing a SMART objective, and this will go into any proposal that you would write or any kind of measurable program that you're working on, you can write this very simple sentence. By this time, this group will have done this thing as measured by these data points. Very simple. And I say very simple, but this is something that many health professionals that I work with, the medical students and health professional students that we train, struggle with every single time, because the goal is to make it very short and specific. And it's really hard to write a very short and specific objective. But this is the template that you can use. And so I want to show you a couple of examples that have been pulled from real world proposals that I have looked at. And I would like you to tell me whether you feel that these are SMART objectives. So let's begin. We will provide health screenings to 100 people from August 1st to August 31st. Is this a SMART objective? Yes or no? Got yeses, I've got no's. All right, I need one person to weigh in on yes, tell me why, and one person to weigh in on no, tell me why.
I think it's obtainable because you have 30 days. And if you have, let's just say, a health fair event, you can obtain the 100 people.
Okay. Thank you, Kimberly. All right.
Daniela in the chat says, how are you going to provide? Chelsea says who, and then Eon says no, what specific people? Vanessa says no, does not tell you what you will do. And Jacqueline says no, does not specify who will conduct the screenings. And Alexandra says it's undetailed.
Undetailed. La Quinta, would you like to add?
Yes, good morning, afternoon now. We actually do health screenings through for our senior citizen community centers here in Galveston County. So we are able to do 100 people health screenings in a month.
I love it. So you're saying that this is a realistic goal, and I think many people probably would agree with that. I think to the point that Brittany was sharing in the chat is that there's still a little bit of specificity missing from this objective to make it really smart, right? So like, what kind of health screenings? Are we going to do A1Cs? Are we going to measure people's weight and height? Are we gonna, and then who are these people? Are they older adults? Are they younger adults? Are they children? Like all of that specificity matters because ultimately it will tell us the utility of what we are doing and whether or not it is aligning with our overall goal. So yeah, great discussion, folks. I appreciate this. Let's do another example here. I'm not going to read this one to you, but I'll give you a hint. By the fact that I'm not going to read it to you, there's a answer.
So we're getting a couple, we have 2 yes and 2 no so far.
Okay.
Another no.
So I'm going to give you guys the teaser on this one. Yeah, Camarella. Sorry if I pronounced that. I'm terrible. The fact that this is a paragraph says that this is not a SMART objective. There's a lot of really good detail in here, and these are the things that you can go into your proposal, but there's no way I'm going to read this. So like if somebody sent this to me as a grant proposal, they're already in the no pile because I can't make sense very quickly of what they're trying to do. So again, you want to get straight to the point and make it very easy for me to see what it is that you're doing. Yeah, more activities than an objective. Thank you, Jessica. All right, here's another one. During our time in this location, we will distribute the same post survey to the original pilot group of 30 students at school received at the end of their curriculum. Got a yes.
We're getting a lot of yeses. Yeah.
Yeah. Yeah, I think I'll be honest with you guys. This is one that I struggle with because I think it has the components of it, but there's still a few things that are missing in my mind. It's like, well, what is the survey measuring specifically, right? What are we looking at in there? Is it a knowledge? Is it an attitude? Is it a behavior? Yeah, so like Iana says, it's still a little bit too vague, but it's getting us to the point of what we're trying to look at. So again, you can see the challenge of trying to do this. I'm going to put 2 more up there. Again, the point is that it's really hard to write SMART objectives. I think this last one is pretty close. From date to date, this number of patients in this place will be given an educational pamphlet to prevent HIV transmission following their route. I think the one thing that's missing from this one is probably the measurement. How are you going to actually measure those things? But it's hard, right? The whole point of this is that it's hard and it takes time and practice of writing a SMART objective. But when you can see them, you can begin to understand why it's so important to have your SMART objective. I'm going to pause here and see if there's any question on SMART objectives before I move on to the next part of this. What do you folks think? Is this easy to do? Has anybody ever written a SMART objective? Feel like you can do this right now?
It's pretty hard. My supervisor had us to do one at the beginning of the year.
Yeah. And the
Well,
beauty
that says
is like
it's
if
not
we're in a
easy.
team project, right, you don't need to do it yourself, right? Maybe get it started and then send it to 4 people and be like, hey, does this make sense? Sorry, go ahead, Brittany.
No, you're fine. Danielle says, yes, I've done some. There's a few that have done and a couple of notes.
Okay. Yeah. And again, it takes practice, it takes time, and it takes feedback from folks, right? Because in your mind, it may be the smartest objective you've ever written. And then you share it with somebody and they're like, I don't get it. And that's the best way for you to then get that feedback and then tweak it a little bit. So, all right, so let's move on. So we've set our goals. We've set our objectives, and the next step for this is to really begin to build our logic model. And what a logic model is at the end of the day is just simply how do you go from investments to activities to your goals and objectives, right? So at its most basic, excuse me, you have your inputs, you have your outputs, and you have your outcomes. So that is what a logic model shows you, is how does everything flow together to get you to that goal that you had already set to address the needs and the priorities that you had determined based on your previous engagement. I want to focus real quickly on this next one, which shows you just a little bit more detail of this same logic model. Is so you've got your investments and your inputs. Within your outputs, there's kind of two components. What are you doing? What are your activities? And who is participating in those activities? And then finally, in your outcomes, you can think about 3 levels of outcomes: your short term, your medium term, and your long term. So again, thinking back to our goals and objectives, your long term is going to be here in your goals. Your objectives are going to probably be medium and short term. And it's also helpful to think about the difference between outputs and outcomes. Outputs are things you can count: number of people trained, number of flyers developed, number of health screenings provided, right? Number of people reached. Your outcomes are usually, they're quantifiable, but they're not those counting things. It's usually going to be knowledge, it's going to be health improvements, it's going to be increased awareness about something. So it's always helpful to think about it in that way, that here is where you're going to count the things you've done. Here is where you're going to show the impact of the things that you've done. So I'm going to show you a couple different iterations of these logic models with different levels of detail. So this is one that's focused on a project to reduce underage drinking. And this is borrowed from the University of Wisconsin. They've got a lot of really good resources on logic models. Basically, you can see the inputs: grant dollars, people, equipment, their partners, which leads them to these activities, all listed out as bullets. And the people who are going to participate in those activities are listed. And then you can see the outcomes here, right? So you've got these short-term outcomes of knowledge, awareness, commitment. You've got these medium-term outcomes of compliance, opportunities to access different things. And then finally, your long-term outcomes are those health outcomes, those big, hairy goals that are going to take a little bit of time to get you there. What you'll also notice on this logic model is there's 2 more pieces that have been added. The first is these assumptions. So it's always helpful to think when planning your program, going back to that plan A, B, C, and D. If these things come together, then I'll be able to implement this project, right? It assumes that we will be able to come together and that my project will be funded. It also assumes that these external factors don't influence the project as you're beginning to implement it, right? So you want to think about your assumptions and your external factors that will influence the success of your program as you're developing your logic model. Here's another version, and then Carla, give me 1 second and I'll come to you, that just shows a more, what we would call like a theoretical flow, right? So you do this input, it leads you to these activities, which leads you to these participants, and then they're expecting this flow of outcomes to be achieved, one outcome flowing off of the other, right? Which is different than this prior one, which just shows you the different outcomes, but not how they're related to each other. Here we get to see, oh, this outcome must be related to that outcome for that to happen. Same assumptions, same external factors happening here. Pause here to see if you have any questions on logic models.
No, Nicole says this is great information and thank you for sharing.
Of course. So logic models take a little bit of time to build, but they are super, super helpful for your project manager because it's going to lead you into your next tool, which is your work plan. So work plan, very specifically, you have a goal. We've already set your goal. You have your objectives. You have written your objectives. You have your strategies, which is your activities from your logic model that then says, here is how I'm going to achieve my strategies. Each of the action steps that must happen to be able to get you to that activity, who's responsible for it, and what's the timeline on which you will be responsible. Kimberly, yes, we'll be sharing slides at the conclusion of the session. Okay, so again, this is all I'm going to share on the work plan. You can build this out for each of your objectives, for each of your activities that's listed out in your logic model, and it begins to give you the tools to then track to make sure you know what you're doing, who's responsible for what, and on which timeline you're going to do it. The complementary tool to your work plan is your Gantt chart. And I do this every single time. I don't come prepared, and somebody can look it up. I don't remember what Gantt stands for, but it stands for something useful. And if somebody finds it, please share it in the chat. But ultimately, this is a visual representation of the timeline on which your activities will be implemented, right? So this is one drawn from one of my own programs that I was leading. And you can see that we'll be doing training here. There'll be graduations. We'll be doing surveys at this time. So again, this just gives you a really simple visual representation of the things that are happening in your work plan. Okay, so you can see all of these tools are building upon each other and helping you get as organized as you can be to execute your project with success. We haven't even gotten to the execution yet phase, guys. We're still just in the planning phase. All of these are tools that are going to help you with your execution when you get there. Last tool in this section, and then we're going to take a pause so I can drink some water and see what questions you have, is your budget. And I'm sharing, like, again, we could do an entire course on budgeting, but I'm going to give you a very basic introduction to it, right? So your core lines are your personnel. So who are the staff responsible for executing your program? And then what are the operating expenses? Those are your two main categories. Within your operating expenses, you can have travel, contracts, other costs. But the basic components of this are, what are the units? How much do they cost? How many of them do you want? And what's the total amount? I like to put my notes here. This is kind of what we call your budget narrative. It explains the why of why you need something in your budget. So it's regularly and easily accessible here in your budget without having to go somewhere else. Thank you guys who are bringing in all the background on the Gantt charts. La Quinta or La Quinta, I want to make sure I say that right. Sorry.
La Quinta, I'm going to put it in I'm going to put it in the chat.
Okay. Thank you so much. I appreciate everyone's active participation in this. Yeah, so it was Henry Gantt. Again, thank you, Christina, for finding. I had a feeling it was named after somebody. Otherwise, it would be a really weird name. Oh, there it is. Graphical representation of activity against time. So here's your basic budget template. Again, this is all you're going to get because I could spend an entire project just talking about budgeting. But again, you want to think about your logic model. What are your inputs? Because all of your inputs should be in your budget with the associated costs. Okay, so every one of these tools is feeding off of the other. Let's pause there. That is the planning. Questions on logic models, SMART objectives, Gantt charts, work plans, any of those tools?
Betsy said she would love a course on budgeting.
Me too. Betsy, if you know, I'm just joking. It's something we can look to build. All right, we're making great time. Let's keep on rolling. So we've now come to the execution phase. We have done all of our planning and we feel so organized and we're ready to go. And so the things that I want to kind of land on here are communication, communication, communication. Projects tend to fall apart because we have either inconsistent communication between all the members of the team or the implementing partners, or unclear communication, right? And so we want to make sure that we're always regularly engaging with our people, with our community that we're serving, with our donor that's giving us the money. We've got to be in constant communication so that everybody knows what's going on. And this is related to roles and responsibilities, which is really what I'm going to spend most of the time in this phase talking about. I'll give you a brief primer on tracking your budget once you've begun the execution phase. And then you'll see checklists. Checklists are your friends. Make sure you've got them. You know, who do I need to email today? What is the budget that I need to work on today? With those tools in hand, you can begin to be very, very effective in what you're doing. So let's talk about roles and responsibilities. And what I want to talk to you about today is this concept called the RACI chart. So RACI simply stands for responsible, accountable, consulted, and informed. So the different levels of this is that within any project, regardless of the size of the team, you're going to have somebody who is responsible for completing the task. Every task needs to have one responsible party. Okay, at least one. Then there's an accountable person, the person who delegates work and is the last one to review a task or deliverable before it is deemed complete. Some tasks, the responsible person may also be the accountable person, but you should only have one accountable person for each task or deliverable, right? Think about it. If you've got more than one boss, how frustrating is that? Because you get different feedback from each of those individuals. So there's one accountable individual that will tell you when you've done the thing you need to be done. Consulted, you can have lots of people who will be consulted on each of your tasks. And oftentimes that is better, right? You want better feedback. How have I done on this? Like, how am I doing? They're going to give you that input, whether it impacts their work. And then finally, there's informed, right? Consulted is giving you input. Informed is simply you are just aware of what is going on in this phase of our project. Okay. So you got somebody who's responsible, somebody who's consulted, or somebody who is accountable, somebody who's consulted, somebody who's informed. And you can build out this RACI chart, RACI, for each of these roles and responsibilities related to each of your specific activities. Okay, so this is the summary of how this works. You can build a really simple table like this one and make sure you share it with people. Never assign somebody a role without making sure that they agree to that role. Right? There's nothing worse than somebody coming to you 6 months later and saying, hey, where's that thing you said you were going to do? And you're like, well, I was never told that I was supposed to do that. I never agreed to do that thing. So make sure that you're always being in clear communication, so that everyone knows and agrees to the responsibilities that they have agreed to. So again, your RACI chart is aligned to your work plan, which is aligned to your logic model. And this is how you get into the execution phase of our work. And then I also just want to remind you that as CHWs, oftentimes we are very collaborative. But our tendency sometimes can be that I'm going to do this myself just because it's easier, right? But if we really want to go far together, then we have to do it together. And so it's important to think about how do we share the successes with each other? How do we lift each other up as we're doing this work? And the RACI chart is part of how we get there. But let's make sure that we're always recognizing the hard work and the efforts that everyone is contributing to a project. The other piece that I wanted to spend some time on in this section of execution is that we have to have meetings. Meetings are a necessity to make projects work. Oftentimes, meetings can be headaches and things that we don't want to go to. And that's because oftentimes those meetings are not well managed. And so to make a meeting useful and helpful for everybody, there's 3 key components. The first is let's have an agenda. Right? How many people have gone to a meeting and you haven't seen an agenda, so you have no idea what you're going into, and then the conversation zigs and zags all over the place, and after you've spent 45 minutes there, you don't even know what you're doing there anymore. So we want to have an agenda, make sure everyone is clear on what is happening. You need to have somebody who is taking notes. It should not be the person leading the meeting. Right? How many people have had to lead a meeting and take notes at the same time? It's next to impossible. I do it all the time. I shouldn't do it. I keep needing to ask for help, but it's really hard because as the leader, as the facilitator of the meeting, you should be focused on the participants and sharing the content. Somebody else should be taking notes and keeping track of your tasks and action items. So when you have these 3 components, any meeting can become successful. And once the agenda is complete, if you've done it in 30 minutes, but you've booked an hour, then end the meeting. You don't need to stay there for the extra 30 minutes as long as you've done the work. Make sure that the meetings are shared with all the participants once the meeting is completed, and make sure it is very clear who is responsible for what and when those things will get done at the conclusion of each meeting. So again, if you get those 3 things included into meetings, they will become less of headaches and more of actually joy and project management style activities. Whoa, what just happened there?
David says that's a very good point.
Yeah, thank you. It's been one of those things that I've had to learn where I used to not put agendas into meetings and then people would leave my meetings. I'm like, why are you not leaving? And then I learned it's because they don't know why they're there. So, all right. So coming to the end of this, managing our financial resources. So this is a very, very simple budget tracking tool. You have your original budget. All you're going to do is you're going to add 2 more columns. The first is what have you spent on each of those lines, and you can create a very simple formula in Excel. And if anybody wants to learn this, I'm happy to share. You basically say this equals to this equals this minus that. Okay. And then that'll give you a very simple way of tracking what exactly has been spent. You have to know what you've spent. There is nothing worse than coming to the end of a project and saying, I've got $500 reserved to feed people at a meeting, and realizing that that $500 has been eaten up somewhere else. And now you've made a promise to your participants that you can't hold true. So you have to track your expenditures to make sure that you're, one, accountable to your donors, but also accountable to the people that you're serving. So the last two phases of this, controlling and monitoring, communication and reporting, remain essential. You want to make sure you're monitoring the work that you're doing, collecting and interpreting data. And it's really important to bake in reflection. And this is both for yourself as the project manager, as a CHW, but also for your team. How are we doing? How have things been going? Are we feeling like we're meeting our metrics? What do the data tell us? So let's look at the data in relation to our feelings, and then it'll help you get that path forward and make sure that you're on your right path to the work that you're trying to do. So on monitoring and evaluation, I want to just say it's really important in public health projects. We've got to both collect data to show our outputs and collect data to show our outcomes. If you are not sure how to do this, resources do exist. Lots of universities have evaluation teams that can be brought on. You can also go to your donor and you can ask them, hey, can you help us with the monitoring and evaluation of this work? And sometimes you can hire consultants, right? Those individuals will help you do those things. But you've got to make sure that you're thinking about it from the very beginning to make sure that you've baked in the resources to do the monitoring and evaluation. And then also make sure that you've got your outputs versus outcomes measured. Look at your logic model. It'll tell you what they are. And you want to think about, how am I going to capture this data?
Aisle in Costco.
Am I going to use paper-based surveys? Am I going to use electronic surveys? You want to think about those things ahead of time because it's going to have some management responsibilities associated with them. Been talking a lot. I apologize, guys. It's hard because I want to make sure I get all my content in the hour that we've got together. The piece that I want to land on here before we begin to wrap up is on reporting. So when we think about the reporting that we're going to be sharing on the progress we're making and the impact that we've had in our community, you want to think about your audience first. Am I talking to my donor? Am I talking to a partner who's part of this implementation team? Am I talking to my community? Because the audience that you're talking to is going to then influence the way you deliver the information. Your donor is going to be interested in dollars spent and outcomes achieved. Your partners are going to be interested in your outputs and dollars spent. Your community is going to be interested in how am I benefiting from this thing that you're doing. And you want to think about the reports as well, right? Because in all likelihood, your community is not going to want to see a 25-page report, but they are going to want maybe a brief presentation to them. They're probably not going to want PowerPoint, but your donor is probably going to want PowerPoint, and they're going to want a written report. So you want to think through, who am I talking to and how am I going to visualize the impact and the work that I'm doing? And so I want to encourage everybody to lean into infographics. This is a graphic that our project manager on one of our projects that I lead has developed. Really simple way of showing all of the outputs that we have achieved over a 3-year period, and one simple to understand tool. But also use pictures. Pictures are wonderful storytelling activities about the activities that you're engaged in, the people that are benefiting from your work. Pictures, as they say, to tell 1,000 words and can be more impactful than a graphic sometimes. But sometimes your donor wants to see the graph. So you got to think about the balance between data and pictures and stories. So as we think about the closing part of our project, we're thinking about analyzing our data. Yeah, thank you, Martha. Brochures, pamphlets, easy to use information that can get it out there and in a sentences and words that your community understands. So we have to think about health literacy. So as we come to project close, we want to analyze our data. We want to go back to our reporting, think about our audience, think about the methods through which we're sharing. And then we want to celebrate and share our successes. So many times we wrap up projects and then that's it, right? We send a report to our partners and then it's like, we just spent 3 years together. Let's actually have a moment where we can celebrate our successes and talk about what we're going to do next rather than just jumping right into the next project. So you want to think about baking those pieces into it from the very beginning. So I wanted to stop here. I've gone super, super fast today, but that's because I wanted to bake this into 1 hour. And I want to see, what questions do you have for me? What points would you like me to go back over? Are there things that I didn't cover enough? Are there questions that you have for me about any of the phases of the project management cycle?
So earlier, when you were going through the Excel spreadsheet, Chelsea had asked if you could put it in the chat, the formula.
Oh, the formula? Yeah. So, I mean, when you're in an Excel cell, you would say equals cell minus. So it'd be budgeted dollar, whoops, minus spent dollar. And if you do that equal sign, it'll then calculate it when you click on those cells.
And then Carmela said, this is probably more than we have time for, but I would love to see the process of fleshing out a Gantt chart.
Yeah, so I'll do this real quick because it actually doesn't have to take too long. But if we go back here and we think about your work plan starting point, what is my timeline on which these activities will take place? You then simply go in and you can use an Excel spreadsheet, same thing that you would use for your budget, and then you just kind of color code it based on your activity. So I anticipate that it's going to take me 3 months to collect our baseline data, fill out your first 3 months. And then from there, I'm going to be training and that will take me 1 month. And then from there, I'll be doing, so again, you can just use your Excel spreadsheet to make a very simple flow chart.
And then a lot of people have been asking about if they will be getting the slides from this presentation.
Yes, slides will be shared. And then, Anna, I see your question about certificate of completion. Yes, I'm going to go to a survey here in just a moment that if folks want a CEUs from Texas DSHS, you must complete that survey at the conclusion, and then we'll be able to get you the certificate.
And then referring
Ruby,
to the Gantt chart, yeah.
Yeah, Ruby, I see your question. For me, this was a tool that I had created, and it just gives me a quick visual representation of different activities. So green was educational activities. Red was nothing happening, right? So here it's like there's nothing happening because it's rainy season. Blue was any research activities. There's no rhyme or reason. It's kind of whatever you feel like, but I try to color code it by my strategies, by my activities, so that I can see it quickly. Any other thoughts, questions, points to clarify?
Oh, sorry. I didn't mean to interrupt. You brought out the check-ins with your team as the project is developing, as your timeline is, approaching deadline or goal and date. And check-ins don't always have to be a team meeting. It can be as brief as maybe an email or just does anyone have any questions? Just checking in with the team. The reason I ask is because sometimes it can be time consuming to schedule planning dates and half an hour every 2 weeks. It doesn't always fit into the schedule. What do you find works best?
So I'll tell you, for my teams that I work with, we have standing Monday meetings, which help launch us into the week. Right? So we set our tasks, we look at each other, we check in on how we're feeling, what we're up to that week. We look at it in relation to our quarterly goals that we've set. And then I will do informal check-ins with folks via text message, via WhatsApp, via our Teams messaging service, whatever it might be. My wife, who is also in the for-profit world, she has what they call, she has weekly stand-up, which is simply the team comes together and says, here's what I'm doing this week, right? And that's it. That's all they talk about. They just tell each other what they're up to. So I think there's a couple of ways that you can do it. I found all of them to be variable successful. So,
Thank you.
yeah. Brittany, can you throw the link into the chat
I
for
was
the survey?
just about to, yeah.
Awesome. Yeah.
Yeah, should be there now.
Perfect.
The link is the same thing as the model completion survey?
Correct.
Okay.
Yeah, you can either scan the QR code or you can click on the link. They'll both take you to the same place. Any other questions? Yes, again, to
Suzanne
everyone's
asked-
point.
oh, yeah.
This was very quick, went through a lot of information. We will put this into a PDF. We will share the slides with all the folks that registered for this.
It will be nice that one day we can get together and do something like a play or practice of doing it together.
Yeah, I agree with you, Lisette. And I think that's where when we think about like continued professional development for this, like if there is a desire from within this learning community, when we finish this entire public health series that we've launched to do some practical skill building, I'd be happy to help kind of facilitate that and bring people together to share best practices.
Thank you. That would be awesome.
So again, if you want continuing education, please complete the survey. Otherwise, you won't be eligible for it. We'll probably send the link out, I'm guessing, as a follow-up to this again, just to make sure. But now's your time to get it done. We got 1 more minute left. If folks have any other questions or comments they'd like to share.
When we get the recording, will I be able to share it with others that I know will benefit from this information? Are you okay with that?
I believe so. I don't, I can't control it if you did anyway, so.
Yes, please. Thank you
Thanks.
for the video.
I had a question. So I just got through doing the survey and it says that I won't be able to receive a CEU, but then every single time I take a class, it does give me a CEU. So I just wanted to verify that.
Are you a state certified CHW here in Texas?
I am not, but I do work at Parkland Medical and I'm just taking these classes for further education for myself and for grad school.
So Alexandra, what we may be able to do is because this is a CHW approved continuing education, I may be able to provide you with a certificate that is like a non-state approved for whatever credentialing you're looking for.
I think there is a few people asking for that in the chat, Jason.
Yeah, what I would ask, and maybe Brittany, I'm wrong on this, but if you need the non-state approved, complete the survey, but if you don't mind, just send us a quick email follow-up just to let us know so that we can work on that for you.
Well, and see, and I tried to apply multiple times to get the actual certification, but due to COVID and everything else, my application was denied from the State Department. So I just was wondering if y'all could help me just get the certification. That would be great too.
Yeah, if you want to reach out to us via email, Alexandra, we can talk about ways to help you with that. All right, folks, we're at 1:01. If you would like to log off, please feel free. Thank you so much again for joining us. Next month, we'll be at this again, and I should have the list in front of me, but I don't. What's the next topic?
It's CHWs and data.
Oh, you get me again. All right. Well, then I will see you guys all next month or whoever joins us. So thanks again. Really appreciate everyone's participation. Wishing you all a wonderful day.
Thanks.
I saw an interesting question in the chat, Jason, about how they can be a CHW if they are outside of the United States. I'm not familiar with that. But I do think it's possible because I do think I've seen people in Africa maybe that are community health workers and they're working towards that curriculum and stuff. I think you're muted. I'm not sure if you're saying anything.
Or I'm talking to myself. I was gonna see, it looks like Monsing is still on the call. Monsing, are you in a place where you can unmute? Tell us where you're calling in from.
Hello. Yes, thank you. So I am from Nepal, and so I just wanted to know that since I'm also a health professional, but I'm not that like officially got CSW number. So is there any way that I can be in the loops so that I can also, broaden my knowledge on the public health things? So I'm just asking for that curiosity. Yeah.
Yeah, no, Monsing, I appreciate your calling in. It's exciting. It looks like we've also got a few folks calling in from Africa. I love it. So for you, you would not be eligible to get certified here in the state of Texas because we do have a requirement that you have to be a state resident to be eligible. But that doesn't mean that there's not mechanisms for you to get certified, maybe in Nepal. I don't know the policies in Nepal. I will say this, one of our project manager, Shan Martin, has led U.S. Agency for International Development funded community health worker projects in the past. And so I'm going to pose the question to her to see if she knows of any international standards for training CHWs or if it's all country specific. And I think the same goes to the question that Muhammad has asked in the chat. But I'll do some investigating. And Monsing, if you don't mind, because things tend to slip out of my head. If you remember to send me an email, then I'll make sure that we follow up with you.
Okay, sure. Thank you so much. Okay.
And
Thank
I'm going to
you.
put my email address, in the chat. All right. Brittany, we got the recording good?
Yeah, I was about to ask if I wanted me to stop recording.
Yeah, I think we're good. And Carla, yes, I'll